With all the talk of COVID-19 vaccinations, it's important to remember there are other vaccinations we need to have throughout our lives. Erica Wilkinson, a pharmacist with Salina Regional Health Center's outpatient pharmacy, joins me. Erica, thank you so much for being on the show. With all the talk of COVID and the COVID vaccinations, I think it's important for people to realize that there are some other vaccinations that they might be missing on, correct?
Yeah, today I'll kind of talk about adult vaccines. Childhood vaccines are pretty easy to pinpoint because most of them are dictated by a child's age. Adult vaccines are a little trickier. Yes, age is one of the factors, but also their health conditions, lifestyle, and their occupation can affect whether or not they need a vaccine or not. Probably the most common one we think of is the pneumococcal vaccine, or the pneumonia vaccine as it's more commonly referred to as. That's a vaccine that we give to people aged 18 to 64 who have diabetes, asthma, COPD, cardiovascular disease, and there's a few other conditions as well.
Okay, let's look at some of the other ones. I know you had mentioned when we were talking before of shingles, and I didn't even realize that there was a shingles vaccine.
Yeah, so shingles is one that's dictated by your age. So anyone age 50 and older is indicated for a shingles vaccine, and there's actually 2 doses of it. You get one, and then 2 to 6 months later you'll get a second one. It's a relatively new vaccine. They improved the formulation over the past 2.5 years, and it's very effective at preventing shingles, greater than 90%.
I know if somebody is traveling, there's some traveling vaccines. How's the best way to know what you need to do in that situation?
Yeah, good question. So the CDC is a good resource on where to start. Some places that are a little more complex can take a trained professional, like a physician or a pharmacist or nurse, to look at where you're going and your risk factors for contracting diseases in that place that you're headed to.
I know tetanus vaccines need to be done how often?
Tetanus is every 10 years you should get a booster, and that's for everyone. There is a Tdap vaccine that has tetanus, and also it protects you from whooping cough. Everyone should have at least one of those doses in their lifetime. Pregnant women will get that in their 3rd trimester with every pregnancy.
And one way to keep track of all this is through the vaccine registry. Why don't you talk about that?
Yeah, so Kansas has a vaccine registry that is electronic, and physicians' offices, pharmacies have access to this, so we can see all the vaccines you've ever had. And it's a good way for us to make sure we're not giving you doses that you've already had, or giving you the right dose, of course. This is an electronic form, like I said, so it's a little better than that little pink card that we used to always get and keep in our wallets and forget where it is.
For more information, please visit srhc.com, like us on Facebook, follow us on Twitter and Instagram.